Now on Extra American Beauty, your questions coast to coast.
What's the best way to get rid of a saggy neck?
That's a good question. Dr. Dorian?
Well, with sagging necklines, that's probably the most common thing that happens with age. Three things. It's the skin that gets loose, it's the fat that builds up underneath the chin, and it's the muscle that gets loose. There's all these different techniques to try to tighten those, but the truth is none of them really work. That's one of those cases that surgery is actually your best bet, and the outcomes are almost always good.
Good to know. All right, well, right now we're taking more questions to separate the beauty from the BS.
We sent two top plastic surgeons to the streets, one in New York, the other in Beverly Hills.
If you look in the mirror and go, oh yeah, then good for you. But if it's more like, then you might have cosmetic questions for a cosmetic doc.
What would you recommend for me?
Is it painful?
Lucky for you, we're hitting the streets of New York and Beverly Hills with two top plastic surgeons. Dr. Julie Edween on the famed Rodeo Drive in Beverly Hills. And in New York City, Dr. Heide Hermand.
I have lots of questions.
Answering every nip-tuck, face fix and burning question you can come up with.
We're here to fight it.
Exactly, so help me.
I'm getting some lines here that I'm getting a little bit concerned about.
Fillers like Restylane or Juvederm or Bellatero work fantastic.
But what do you do like right in here?
So what we want to do is we want to rev up those skin cells like collagen. How do we do that? Lasers is a good way.
Yeah.
I was just thinking of these lines that are now occurring.
The best way to take care of that is Botox. Basically, it's a small injectable. It takes that muscle, relaxes it.
I've just turned 32, so is it kind of something you would recommend?
It's an easy thing to do. Early on, you're really pretty young, but it's more of a preventative thing.
I've been seeing people that go way too far with Botox and Juvederm.
You have to balance, and make sure that you don't put too much in your lips, you don't put too much in your cheeks, and what you leave with should be a better looking you.
Is there any area of concern?
Like most people, my midsection.
We have the liposuction, which I'm sure you really know about, but there are great, less invasive, non-surgical options now, like cool sculpting, where you actually freeze and melt the fat down.
Online now, reality star Brittany Gastineau freezes her fat. The crazy video at EXTRATV.com.